स्टार्ट किया कर दिया ओके Hello everyone, I Dr. Urvi Maheshwari, consulting physician and diabetologist at Jain Shalby Hospital, Ghatkopar, Mumbai. Today is a World Health Day, so wish you a very happy World Health Day to all. And today we team of doctors of Jain Shalby Hospital would like to enlighten you all about what is health, how to take care of it and how to prevent certain disease. Because many of the time we become so careless in our day-to-day activities that we do not take care of our health. So today I have with me my colleagues, my friends, my seniors, Dr. Chetan Jain, he is a pulmonologist, Dr. Priyanka Tater madam is a neurologist, Dr. Jayesh Desai sir is a very good nephrologist practicing in Jain Shalby Hospital. So we all would like to share you certain information about lungs, kidney, liver, heart, the entire body, how to take care of it. Right? So welcome you all doctors. Dr. Chetan, let's start with you. So in today's era where there is so much of pollution and everything, so there is a lot of allergies, asthma, COPD seen. But then can you tell us what mask we can wear or what special mask any patient or asthmatic patients can use, or should normal patients or normal person should wear mask or no?
Thanks Puri for the question. It's a very nice question because in today's era, post-COVID, we have seen use of mask haphazardly. Not many patients wear mask, but they don't wear it as it should be ideally to prevent yourself. So first thing, mask is one of the good device to prevent majority of your respiratory issues, right from pollution related issues, infection related issues, and also the viral syndromes and all. First thing and foremost, your idea why you are wearing a mask has to be very clear. When you are wearing a mask, so there are two types what we look for. One is a medical mask and one when you think of anti-pollution mask, which can protect you from the dust, particulate matters, smoke and gases and everything. So we should always concentrate when you are going out, especially in the pollution areas. That's the time when you should wear anti-pollution mask. Second is the medical conditions where you are infected with some diseases which can spread, like the respiratory viral infections, or it can be like TB or other diseases where chances of you spreading it to others. So that's the time when you require a proper mask. That is your medicated mask, which are N95 mask. Second point, when you look at the mask, is your fitting. You can't wear any ill-fitted mask. What I mean, it should completely cover your nose trim, should completely cover around your mouth. So the mask has to be tightly and snugly filled so that you don't get exposed to the dust particles, and when you are infected, you don't infect the other people. So that's how you should look at the mask.
Okay, so I think even if somebody at our home has some kind of a viral cough or cold, do you suggest we should wear a mask at home?
Yes, so those patients, especially when you are at home, you have symptoms of cough, cold, fever, rhinorrhea, that is running nose, sore throat and all, you should ideally wear a mask. If you are not comfortable in wearing an N95 mask for a prolonged period, you can use the 3-ply surgical mask which can cover your nose. Make sure that the nose clip is completely pressed so that it can give you a good support and catch the respiratory infections and droplets so that they don't spread to the other people at your home also.
Right.
Especially when you are with the people who are aged, who are diabetic, who are immunocompromised for some reasons.
Right. So even in these days in schools also we are seeing if the one kid is infected, the others also start having a viral cough and cold. So yes. I think even in kids, if somebody has cough and cold, we should inculcate that culture of using a mask in the school also if the kid is infected, so that it does not miss the school and should not spread infection to others.
Yes,
but then when we are at home, there is so much of pollution outside, we can use a mask. Now, is there any technique to curtail the pollution inside? We are listening of too much of use of air purifiers at home. So are air purifiers effective, and should only patients use, or should a normal healthy person should also use it?
So now, as you see in last 3 months, our news, data and everywhere, if you see, there's a lot of discussion on air quality index and pollutions and everything from November onwards, when we have start of the winter was there. So definitely air purifiers does work. Only thing is you need to make sure that you take it from a certified laboratories air purifier, not any air purifier. Secondly, it should have a good purification method where you use HEPA filters and all. Third, it is recommended, as Urvi ma'am was asking, whether it should individual with a healthy person or an infected patient or whom to use it. So ideally when you have patients at home or some people at home who are immunocompromised or have respiratory issues because of dust and pollutions, and there's somewhere where you can't cut down the entry of dust and pollutions from in your house. For example, if you have a roadside house, if you have a shop which is roadside and though it has a shutters, but it can't prevent the entire dust flow to come in and obstruct. So that's the time air purifier helps, because it helps you to purify the air and reduces your chances of infections and allergies because of that.
Right. So, of course, you gave a fantastic knowledge, but then if you can share, I mean, we are exercising daily. So many people are confused. What time of the day should we exercise? It is early morning or evening, or is any difference in the air quality, or should we use mask during the exercises, or how to go about it?
Yeah, so exercise is one of the new thing which everyone recommends. Your family members, everyone recommends you should do exercise, you should do exercise. But remember one thing, in Mumbai, right now because of this high level of pollutions which we have, we need to select a timing where you are least exposed to pollutions, because doing exercise in a polluted environment is also not very good for your health, because it will inhale all the dust particles, smoke, fog and everything, which will create issues. So if you stays in an area which is around a roadside area where you have direct pollution access, all your pollution and everything is there in your society and all, then you should try to avoid and take it early morning hours when your sun has just started. Sunrise has just started, there is a small amount of heat which is there, because if you do it early morning before sunrise, there is something which is known as smog, which is a mixture of your smoke and fog.
Right.
So that also affects a lot of lung issues. So when the smog starts settle down, when they start of say around 7:38, when it's just sunrise started, that's the ideal time to do it. Second way, when you are away from all this environment and all, then both morning and evening hours are better, but mornings are preferable because that's the time when all the dust and smoke particles settles down. So if you're around in traffic areas and polluted area, then it is better to do it when the sunrise starts. Otherwise, morning hours would be better hours.
Right, right. We all know that active smoking is bad, but does passive smoking is equal bad, or it is okay to do passive smoking if somebody is smoking besides me? So should I walk away, or it's okay if I stay there?
So Urvi, that's a nice question, because nowadays if you see youngsters, they all are very, very educated about smoking's ill habits, and many of them don't smoke, but significant proportion of our population, especially the youngsters, they still smoke a lot.
Right.
Or they have friends who smokes a lot. Even after explaining them, they don't smoke. So what we know as passive smoking is when you are with a person who is smoking. So you actively are not smoking cigarette, but the exhale, the smoker is exhaling out, you do inhale that, and that is also passive smoking, and that is also equally bad. Just to make it very clear, it is equally bad, and it affects you in the same way how a direct smoke exposure affects you.
Right.
So not just nicotine in that, but the other dust particles, other smoke particles and different gases and high levels of heavy metals in them, especially when they are BD smokers and unfiltered cigarettes, that's the time you get exposed to equally bad smoking ill effects. So passive smoking and active smoking both has to be avoided completely.
Right. So are there any precautions which especially patients can take? Maybe like who have allergic bronchitis, asthma patients, COPD patients. Any precautions you would like to tell us what we can
So
do?
first and foremost is know your allergies. When you know that you are allergic to XYZ thing, avoidance of the allergen is the best way to treat that. Second best option is to do regular exercises, as I told you, just to time schedule yourself and do regular exercises, especially your breathing exercises and aerobic exercises. That will help up in building your lung capacity. So that will help you in fighting with all the respiratory infections and all. Third and the foremost thing is your diet. Now with this fast food generation going on, our diet is very less, especially when we talk of antioxidants and all and vitamins, which is easily available from the fresh fruits. So try and take as much of fresh fruits and fresh vegetables possible. Not the juices, but direct fresh fruits are much better than using in juices and processed foods.
Right. Because with the bad health, now these days it's seen that once you have low oxygen, you are not happy breathing wise, we have so many of the other systemic diseases also. So in fact the headaches have become very common. Dr. Priyanka, would you enlighten us? These days we are seeing too much of headaches, And what are the common headaches seen on a daily basis? Is it something to worry about, or what can we do to treat them, or how we can prevent them?
Yeah, so we come across a lot of headaches in our OPDs, which is actually a bread and butter for a neurologist. So the headaches that we come across commonly are the primary headache disorders. So these are headache disorders where the scans of the patients are usually normal. So they are more worrisome about it that there is nothing in my scan and still I am having a headache. So the headaches are of this type, that the scans are going to be normal but you are going to experience headaches. So they are called as primary headache disorders. The most common ones that we come across in our OPD are our migraine headaches and tension type of headaches. So here structurally everything is okay in your brain, but there are some biochemical changes which are happening in the brain which are giving rise to these headaches. So they are not life-threatening is what we need to understand. Now these headaches are usually called as lifestyle disorders. So any change in your lifestyle will precipitate these attacks. And there are a lot of triggers for these headaches which we need to identify, and if we take care of the triggers, the headache attacks can actually be prevented with minimal medication. So the common triggers that we come across in patients with migraine are skipping their meals, being exposed to sunlight, loud sound. Some of them cannot tolerate certain perfume smells. They don't sleep on time, they don't eat on time, they're not exercising, lot of stress. So all these are triggers for headache. So we always tell them to adopt a healthy lifestyle. So if they are eating on time, sleeping on time, doing regular exercises, trying to be stress-free, identifying their triggers and trying to avoid it, which is sunlight, loud noise. There are certain food items also, excessive coffee, alcohol, cheese, chocolates. The trigger can be specific to that person. So he needs to identify that, avoid that food item, keep himself well hydrated. So if we take these precautions, use of medications actually becomes very minimal in these patients.
I'd like to just tell you my cause of headache is the mobile phone. The unnecessary phone calls, the people they do us, that triggers the headache.
So they say that migraine is actually a disorder which is very common in the neurologists. You know, so out of 5, if you meet 3, they'll tell you, we have migraine. Okay. So like my trigger is a simple cucumber. If you eat cucumber, that day you're going to have a bad headache. So it can be a very simple thing, So the triggers are going to be specific to the individual. So you need to identify them and avoid.
Right. Madam, we see so many patients. Sometimes we are just walking in, some patient they have a convulsion on a road. So if any precaution in just a layman, what they can do to help that person before he lands up to a hospital?
Yeah, so very common question that we come across, where the patients or the relatives want to know that if the patient is actively seizing, what do we do, doctor, in that situation?
Right.
Because it may take time for us to transfer the patient to the hospital. So ideally, if you see anybody actively seizing in front of you, the first thing that you do is, if there are any sharp objects around the patient, try to remove them because the patient may get injured because of that. Always try to put the patient in a lateral position, preferably a left lateral position. Any contents that are there in the mouth, the froth or the bleeding, will come out of the mouth and the patient will not aspirate.
Okay.
Third thing is, if there's something very tight across the neck of the patient, please try to loosen it, otherwise he may suffocate because of that. Very common practices which every one of you may have heard, that patients, relatives try to put a spoon in the mouth. They try to make them smell an onion or a sandal or a chappal, which is really not required, because most of these attacks will subside on their own within a minute or 2.
Okay.
Right? Once the attack subsides, obviously the patient is a little conscious, we transfer the patient to the hospital. So ideally this is what we should do, very minimal.
Right.
Doing more may cause more harm to the patient. I recently had a patient, a young girl, she's 16 years old, she had a seizure at home. So the mother thought that I need to do something, her teeth were completely clenched. She tried to put a spoon into the mouth and she broke her tooth.
Oh.
And she had a birthday in 1 week. So she was very upset. When she got conscious, she looked at herself in the mirror and she found that there's no teeth. So they had to actually go to the dentist, get that fixed, and then she was bothered about this.
I guess the implant was her birthday gift.
Exactly. So simple things, put the patient in the left lateral position, keep the environment safe, don't try to put anything into the mouth, the seizure is going to subside within a minute or 2. Sometimes some seizures may last more than 5 minutes. If you have an SOS medicine which is available in the house, if you get regular seizures, you can use the midazolam nasal spray. Otherwise, the best thing is to transport the patient to the nearest hospital.
Okay, because these days with lots of corporate pressures and all, we are seeing so many young people also having so many complaints like headaches. Many of the young guys, they are getting stroke. So what are the reasons of this stroke and how do we identify whether it is just a stroke or anything else, and can anything be done to prevent it, or what are the risk factors basically for stroke?
Yeah, so stroke, another very common neurological problem that we come across. So usually the risk factors for stroke include your diabetes, hypertension, high cholesterol levels, obesity, not doing any exercises, and obviously exposure to toxins like smoking and alcohol. These are modifiable risk factors, something that we can do something about. That is, control our diabetes, control our blood pressures, let's take our medications on time, be on regular checkups with our physicians, keep our cholesterol under check. We can use statins for that. Good healthy lifestyle, that is having a nutritious diet which has more of leafy vegetables and fruits rather than the junk food and the fast food that we consume. And obviously a daily routine of exercise, which is at least 30 minutes of exercise, if not daily, at least 4 to 5 times in a week also you can do. That will actually help a lot of things in your body. As Dr. Chetan has also pointed out, very good for your lungs and very good for your cardiovascular and your brain. So these ways we can prevent these risk factors. Now there are certain non-modifiable risk factors which we cannot do anything about. That is our growing age, the male sex, the ethnicity and the gender. But the modifiable risk factors can definitely be taken care of, and we can prevent or reduce the risk of stroke. And smoking, particularly, as Chetan has said, has its own problems. Definitely a very crucial risk factor for stroke also. So I think preventing and avoiding exposure to these toxins also.
Because these days with too much of stress and a bad lifestyle, we are seeing lots of people, even young girls, guys, they all are having alcohol, smoke and everything. So I guess that is the main reason for increasing strokes in young these days, because initially it was a disease of the elderly,
Right.
but now we are seeing even in 30s.
Right. So also, as you had asked me, what are the symptoms and how will we identify it, is brain attack and heart attack. The mechanisms are almost similar, but people are more aware of the heart attack is because it's associated with a lot of pain.
Right.
So, immediate help is sought.
Right.
But in case of brain, usually the symptoms are more on the negative side, like we very commonly use a mnemonic which is B fast to identify the symptoms.
Okay.
B stands for balance. So anybody who has sudden difficulty standing, feeling like he's going to lose his balance, it may be a warning sign for a stroke and he needs to seek medical help. E stands for eyes. So any double vision, any difficulty in seeing one half of the field or any blurring of vision from one eye also is a pointer that the patient may be suffering from a stroke. Fast, F being for the face, for a facial droop, so sudden facial deviation, also which leads to slurring of speech, so also something which we need to take care of. A being the arm, so any one arm or one leg being weak suddenly, being numb suddenly, needs to be taken into care. S stands for speech, so any change, alteration in the speech, or the patient is unable to understand what you're trying to tell him. So these are various symptoms that we come across which are sudden.
Right.
So it will be like a lightning has struck, something
Right.
like that. And T stands for the time. So time is very important in stroke. So the first 4.5 hours of the golden time is what needs to be kept into mind, because if the patient is shifted to the hospital during that time, we can use clot busting agents to improve the condition of the patient.
Beautifully explained. Madam, I wanted little update about Parkinson's. These days we are seeing so many Parkinson's cases. So is there anything which we can prevent it, or is there any treatment especially for Parkinson's?
So as we all know, April is the Parkinson's Awareness Month, and we have an upcoming 11th April which is celebrated as the World Parkinson's Days. So Parkinson's disease is basically a progressive neurodegenerative disease of the brain. What do I mean by that? So slowly there are certain cells in the brains which are dying. These are particularly your dopaminergic producing cells which are present in the basal ganglia, the substantia nigra of the brain. Now with time we have also realized that it's actually a more complex disorder which has a lot of motor plus non-motor symptoms as well. So the motor symptoms that we find in these patients are usually a unilateral resting tremor where the patient's hand is shaking. The second is the body is becoming stiff or rigid. The third symptom that we see is bradykinesia, which we know as slowness of daily routine activity. So they will realize, wearing the clothes, eating the food, doing any day-to-day activity, the speed and the agility has gone down.
Right.
And also the patient's gait changes, so they start taking short shuffling steps. The movement of one side of the body may get reduced. So a lot of these patients, we actually identify them even when they are walking into our OPD, so there's a look, a hypomimic face, a stooped posture, one hand not moving very well, it's trembling,
Right.
and the patient is slow. So we know that this patient has something which is called as Parkinsonism,
Right.
and then obviously we want to evaluate it further. So there are a lot of treatment which is available. So a lot of symptomatic treatment is available in the form of dopaminergic medications which we can give to the patient, and they can have a reasonably good quality of life and can have minimal symptoms and
Right.
good mobility and activity. Advanced cases of Parkinson's, we have other therapies in the form of intestinal gels, we have apomorphine infusions, and in patients who experience a lot of fluctuations on and off periods, we also have something which is called as deep brain stimulation surgery for these patients. So there's a lot of treatment which is available nowadays. It's just that the patients need to be on good follow-up with their doctors.
Right. So are Parkinson's and dementia the same, or they are different, or who gets dementia, or what exactly it is?
Right. See, so dementia and Parkinson's are obviously two different spectrum of disorders. Dementia is basically a cognitive problem that the patient is suffering from. So there are 6 cognitive domains. So a decline in any of these cognitive domains can be a signal that the patient is going to develop dementia in future. Most commonly people think that it is a memory problem, but there are other functions also which are affected, like language of the patient, executive functions of the patient, the social cognition of the patient, and the visual spatial abilities. Right? So usually we see it in the elderly age group somewhere around 60-65. So the most common cause that we are aware of, everybody's heard the term Alzheimer's. So that's the most common cause of a degenerative dementia in the elderly population. Almost 60-80% of the patients that we see suffer from Alzheimer's disease. Unfortunately, currently we don't have medications which can stop the progression of the disease, but we do have some medications to take care of symptoms that the patients suffer from. Yeah, so there are anticholinergic esterase inhibitors in the form of donepezil, rivastigmine, memantine, which is an NMDA receptor antagonist that can be used in the mild to moderate cases to keep their attention good. And we have medications for patients who have behavioral problems, psychotic problems. So we can use medications to reduce that kind of behavior. Otherwise, the treatment per se for dementia is more of a comprehensive care. Where there are lifestyle things, nutrition that we need to take care of, keep the environment in the house safe for a patient who is suffering from dementia, and all those things.
So
but unfortunately, no medicine to halt the progression of the disease at present.
Okay, so getting the patients checked early for dementia and Parkinson's, is it beneficial or no?
Yes, definitely it's beneficial because the patient and the caregivers are aware of what the condition is. Initial stages medications do help, and they can always prepare and plan, that how the disease is going to progress and what all we need to do to really take care of our patients.
Right.
So definitely it will help.
So I think we should start the trend, like we take our bachus for a pediatric checkup. We should start treating our parents also for a regular pediatric checkup, so that we can catch a few of the diseases early and can treat it accordingly.
Yeah, definitely.
But many of the times what happens, I've seen patients self-medicating themselves. They just have pain, they pop up a painkiller. If they have fever, they just grab an antibiotic. But they don't understand all these taking painkillers and antibiotics is bad without a proper evaluation or a prescription. And we have seen too many patients who damage their kidneys basically due to this. So Dr. Desai, can you just tell us how important are kidneys for us, and do these painkillers, antibiotics are bad for our kidneys? What can we do to protect our kidneys?
Thank you, Urvi, for having me on the panel. And I'll try to give some information regarding the kidneys to share with our audience.
Yeah.
Kidneys are very vital organs. People think that only heart is the vital organ. For me, all organs are very vital.
Right.
Dysfunction of any one of them affects other organs as well, directly or indirectly over a period of time.
Right.
Now, kidneys, though a small organ not visible outside, plays a very big role in management of multiple functions it does. Right from throwing out waste products, from day-to-day metabolism that whatever we eat, all that is excreted, what is not required for the body. Secondly, it also produces certain hormones which will increase like erythropoietin, they will convert vitamin D active form, they will destroy insulin. So that way it affects your metabolism as well. Number 3, it will also have big role, very critical role in management of blood pressure. So every kidney disease patients can indirectly have a secondary hypertension or uncontrolled hypertension or long-standing can affect kidneys. So it is both cause and effect relationship. Now, prevention is always better than cure for any disease.
Right.
And early detection of the kidney disease is not very difficult task. You just do one urine routine examination with a lot of information. Secondly, you do certain couple of tests, like say you do your creatinine or you do an ultrasound, and it tells you whether you have a active problem going on. Then it's a matter of evaluation that what kidney disease you have. But before we develop a kidney disease, iatrogenic kidney disease definitely can be prevented. And what can we do? Number 1, because it is throwing a lot of waste products, a lot of chemicals, we drink adequate water. Say 2.5 to 3 liters for sedentary lifestyle in India, being a very humid country, very hot, especially in Mumbai with humidity very high.
Right.
2.5 to 3 liters is usually recommended. There is no hard and fast rule. It can be debatable, but that is general recommendation is 2.5 to 3 liters. So there are all the things of flush starting.
Right.
So especially for those who have stall forming tendencies in the family or certain areas, this is very, very vital. This is a part of treatment. Secondly, to prevent the substances which affect kidneys. Now, most of the substances are either metabolized in the kidney, that is, they are either eliminated or they are destroyed, and that's why they pass to the kidney.
Okay.
And during that process, it can affect kidneys. Like simple antibiotics like, penicillins also can affect kidneys. But this is very often overlooked, especially when you're using an ICC or things like that.
Right.
A lot of interstitial nephritis can be seen with abuse of antibiotics.
Right.
Same way with painkillers, especially in elderly, who generally have a tendency to pop in painkillers because of osteoarthritis or some frozen shoulders and backaches. Now, if they consume these, what we call NSAIDs or the painkillers over a long period of time and on routine basis, then it can affect especially the elderly with comorbid conditions.
Okay.
And it can produce acute kidney failure as well. And if it is used for a long time, it can produce chronic kidney failure. So that way it should be prevented. Like there are many more, like especially I would stress here that Ayurvedic medicines, which is a fad of modern world, everybody wants to use Ayurvedic medicine. It is not as safe as it is thought to be.
Okay.
The quality of Ayurvedic medicine is extremely important. If it contains heavy metals, definitely affects the kidneys.
Okay.
Recently, you know that in Akola there were 3 cases reported from same hospital. They were applying just skin ointment to become a fair and lovely, kind of thing.
Yes.
And they developed, all 3 of them developed kidney failure because that contained mercury.
Okay.
So simple looking things like this can be very toxic for the kidneys.
Right.
And with ever increasing pollution, even hydrocarbons now are thought to be a cause of kidney disease.
Okay.
So
do you
that way it is
suggest-
very
Yeah.
important that lifestyle as usual, like for every organ, lifestyle is the first thing.
True.
Keep a healthy lifestyle, avoid known toxic compounds.
So do you recommend every person should go for a regular kidney checkup, or it has to be only patients or at certain age group?
See, kidney disease is prevalent right from childhood to the elderly.
Right.
The spectrum is very big. In childhood, if you get recurrent infections, like you might have a condition called as vesicoureteral reflux in kids, or in male children, you can have a valve, hypertrophic bladder valve there, or PU valves. So this is usually this is the childhood, and females they can get a urinary tract infection more common than males.
Okay.
As we grow, if we have comorbid conditions like diabetes, hypertension, and or other systemic diseases for which we are taking drugs, then some of them may require monitoring of the kidney functions. So you do in such patients very frequently the urine examination or whatever is recommended.
Right.
But for every individual, I think we have seen so many kidney diseases are asymptomatic, and we pick them up only during pre-employment checkup. A lot of them, they go for pre-employment checkup. They come to us with an abnormal report because they want fitness certificate.
Right.
And then we find that, they have underlying global arthritis, somebody has underlying interstitial difficulties, and so on and so forth. So that is one. So I would suggest, though there is no definitive protocol as such, but after the age of 40, it is best to go undergo checks once in a year. Because it's a very simple test you can do, and you can find out whether you're developing. Just do simple urine and creatinine. Basically, majority of the disease can be picked up.
Right.
However, I must add that these two can be normal and still there can be a kidney disease.
Right.
But when we want to pick up these cases early, if you have abnormalities of these two or either of them, definitely we have to work on that.
Right. So what are the symptoms if you have a bad kidneys or if you have any damage to the kidneys? So how can we know that my kidney is getting damaged? Are there any symptoms?
Yes. So as I said, what if you are asymptomatic, which you cannot pick up, you incidentally pick them up, or you have symptoms depending on the severity of the kidney disease, what stage you are in. Like a patient who comes with swelling of face or puffiness, or the swelling of feet, or the body, full body.
Right.
And especially they say that when we get up in the morning, our face is swollen, and we can't see or open our eyes at nights. So when they are losing a lot of proteins, they get a lot of swelling, and this is one of the signs and symptoms you can say of the kidney disease. Second one is if you are passing frank blood or the microscopic imaging, when you do the urine test, you find that you are passing proteins in the urine or blood in the urine. That's another indication that you are harboring a kidney disease.
Right.
Number three, sudden appearance of blood pressure in a young patient, especially less than 30 years of age. Renal hypertension is the commonest cause of secondary hypertension. So that is another one where you have to investigate for kidney. Because you might have a renal artery stenosis, narrowing of the blood vessel, the artery which is supplying blood to the kidneys. It may be unilateral, bilateral, but it can produce hypertension.
Right.
Secondly, you can have low hemoglobin. You look very pale, or you get fatigued very fast, and you find your hemoglobin is very low. Though the nutritional anemia is commonest in this country, but renal anemia is one of the important signs to pick up. When you investigate anemia, you find, you have a kidney problem.
Right.
So like that, we have many symptoms like that. Or in advanced stages, one can get convulsions, or one can get breathlessness because of acid collection or volume overload when lungs are congested. Patient might have nausea, vomiting, no appetite.
Right.
Or sleep disorder. Suddenly he keeps awake whole night and sleeps in the daytime.
Right.
So itching of the body. Multiple organs, as I said, are affected. So you preserve kidney, you prevent so many complications.
Definitely. Now I understand not only heart, kidneys are equally important.
Yes.
So is it true that every diabetic patients they develop kidney problems in future? Many of the patients they have conceptions that because I take diabetic medications, my kidneys are going to be damaged, so they do not take medication. Some people have in mind that I am taking, my doctor will shift me to insulin, which is bad for my kidneys, and I will develop kidney problems and I'll land up on dialysis. So what are these misconceptions? If you can just throw some light of diabetes relation to kidney and medications and insulin, what has to be done?
Good that you brought this point, because diabetic population is ever increasing.
Right.
So we are the capital of diabetes, unfortunately. And 35 to 40% of these patients will develop kidney disease and kidney failure. Not every diabetic patient, every kidney disease in a diabetes is a diabetic kidney disease.
Okay.
Let's not forget that diabetic patients are not immune for other diseases, kidney
Right.
disease. So one can have a diabetes and not a diabetic kidney disease, but develop some other kind of kidney disease.
Okay.
But diabetic kidney disease is present in almost 35 to 40% of patients. Unfortunately, it is to be picked up early, because if we can diagnose very early by doing urine microalbumin, very simple test.
Right.
And usually after 5 years of diabetes, it's worthwhile doing this test once in a year at least, or once in 3 years in a younger age, and then once in a year. And especially if you do not have an eye problem because of diabetes, diabetic retinopathy, the chances are that this kidney disease may or may not be diabetic.
Okay.
And one has to confirm by doing a biopsy.
Right.
Management differs significantly. Now, if I pick up a patient with microalbuminuria and diabetic of 7-10 years old, then what can I do? One, I have to advise the patient that you are now on sitting on a bone.
Right.
Take care, then we can give you a longer period of life without going on dialysis.
Okay.
So, retarding the progression of the kidney disease, how can we do it? By controlling adequate glucose control, blood sugar control, by whatever medications your doctor advises you.
Right.
Control your blood pressure if you have a comorbid blood pressure. Control your lifestyle along with that. Is you do regular physical activity, physical exercises, not only life, or depending. But some people they insulin ज़्यादा ले लेंगे, let me eat.
Right.
Today is my birthday.
Especially mango
And
season,
yeah,
sir.
so the cheat days are more than the regular.
My many
days.
patients they demand, madam, mango का season है, आप हमको कुछ बोलना नहीं. We come with the sugar reports after the season is over. Then
That's
you
right.
decide our dose.
That's right. And secondly, once I know patient has a microalbuminuria, I can start on ARB or ACE inhibitor kind of drugs,
Okay.
which will protect the kidneys.
Okay.
And now the newer drugs have come called gliflozolin or DAPA or empagliflozin, which is
Right.
available in India.
Okay.
It is also known to protect kidney and heart both.
Okay.
So our choice of antibiotic agents or the anti-diabetic agents or OHA as we call it is changing.
Right.
The diabetic agents by itself generally will not harm the kidneys.
Okay.
Will not harm the kidneys. And insulin is a normal hormone which is produced by the body. Why should insulin damage the kidneys?
Right.
In fact, when the kidney is damaged, the requirement of the insulin either decreases or might disappear.
Oh.
People feel that their diabetes is अच्छा हो गया. But unfortunately, you develop kidney failure. That's why your sugar is well controlled.
Right.
Because normally kidneys which were destroying insulin now not able to do so because of dysfunction, and that's why your sugars are well controlled. So in fact, you have a higher tendency of developing low sugar.
Right.
So that's another sign of tricking a patient that we might be having kidney disorder.
Right. So diabetic patients should not be very happy if suddenly the sugars are under
No.
control or drop down. Then you
Yes.
need to evaluate your kidneys.
Yes.
That can be an indication that your kidneys are being damaged. So immediately visit a nephrologist as early as possible. That would be
Or get
better.
it checked.
Or get
Yes.
it checked. Right. So but is it true that once you start with dialysis, so it has to be done lifelong, and do all patients of diabetic patients require dialysis?
No,
or?
it's not true.
Okay.
It's partly true. The kidney damage or the kidney failure are of two types. One is acute, one is chronic. Acute means less than 3 months of period,
Right.
and chronic means more than 3 months.
Right.
Now, how do we know one has a kidney failure? The creatinine will increase because that is a substance which is totally excreted by the kidney. So when the kidney function drops, the excretion decreases, so blood levels rise. And it's one of the chemical which is produced regularly in the body by the activity of the muscles. Now, if you have an acute kidney failure, say because of malaria, dengue, or some other infection, septicemia, all those things, or acute heart failure because of
Right.
massive, heart attack,
Right.
then they can go into acute kidney failure.
Okay.
Now, if this patient's, the nephrologist will decide when he requires support. Now, dialysis is an artificial purification system of the blood, which takes over partly the functions which a normal kidney was doing. It cannot replace the normal kidneys. Just remember, it's a supportive function.
Right.
So, if a patient has got an acute kidney failure, till his kidneys recover, one may have to give him a dialysis support.
Okay.
Which could be a blood dialysis for hemodialysis or a peritoneal dialysis in kids very often. Nowadays even hemodialysis for kids also is available.
Okay.
And this kidneys, once it improves, they stop dialysis.
Okay.
Correct? So, and the chronic is where the kidneys are damaged beyond repairs and the function is so less that it cannot sustain the normal lifestyle
Right.
of the milieu interior of the body. That
Right.
means maintaining the balancing of the body. You know, kidneys does a lot of functions, as I said earlier, fluid, electrolytes, mineral metabolism and all those things which will affect all systems. In that case, you will have to give him a support of an artificial kidney support, there is dialysis support. And by doing so, we are replacing doing or helping to do the function which kidney was doing 24/7. We will be doing 3 times a week maximum, 4 hours each session. So that's 12 hours.
Right.
But it has been found that you can survive on that supporting treatment till you get a proper good therapy called the renal replacement therapy or the transplant.
Right.
The kidney transplant is the best option. But if you do not have a kidney transplant option for X, Y, Z reasons, then one might continue on dialysis. And I'm happy to say that we have been able to save many lives now. Earlier it was said that once you utter a word kidney failure means your life is, like today we say in some of the advanced cancers, 3 months, 6 months.
Right.
Yes. Earlier kidney failure was once upon a time when I was a student. When the kidney dialysis centers hardly, we used to see a lot of such patients. Unfortunately, many of them succumb to the disease because of availability problem.
Okay.
Now it is not so. Every suburb of Bombay has not one but more than one dialysis center.
Right.
And unfortunately, all of them are very busy because of the ever increasing population of the kidney disease.
Right.
One, new addition of the patients because of the comorbid conditions. Secondly, extended survival of these patients on dialysis.
Right.
My personal experiences, my longest surviving patient today is entering his 25th year
Oh.
on dialysis. And even in charitable organizations where I spend most of my life, we have given, patients have survived, not me, but patients have survived for more than 10 years, many.
Okay. So that
Now,
means
of
if
course,
you dialyze,
all
it's
survival
good.
will depend on what is your age, what are your comorbid conditions, whether you have any other organ involvement, etc. How careful are you with the instructions given by the doctor regarding diet especially,
Right.
the medications especially. Because a fatigue sets in after a certain period of time. If I tell you don't enjoy a pizza for lifelong, you will say go hell with you, I go to the other doctor. So it is a difficult task. Compliance is not that easy. But whatever best we can do, we have to motivate our patients to be compliant with drugs and medications.
Right.
Because our patients on an average are around 15 to 20 pills a day.
Right.
And that's, even I forget my antibiotics if I have to take 5 to 7 days. So it's not easy.
Right.
Compliance is a tough task.
But then in today's scenario, I guess, as you said, if you require a dialysis, it's not bad to start with it because many of the patients are reluctant because they think in a dialysis started means that you don't have a good life and you are not able to enjoy your life and you won't live long. So I guess with dialysis, we are able to increase the life of a patient.
Yes, for sure. Like all acute renal failures do improve. I mean, majority of those who improve, they do pretty well.
Okay.
And without that dialysis, he would not have survived. He would succumb.
Right.
So sometimes it's a mandatory to give that support.
Right.
Now, whether it will be permanent or not depends on his underlying condition.
Right.
What is his underlying disease? What is his underlying kidney function?
Right.
Suppose some chronic patient who is stable at a creatinine of 3 hours, that means kidney function is not to less than 30%.
Right.
Such patient may otherwise pull through without dialysis. But if he gets an acute insult, say septicemia or say COVID, his creatinine will go up, he will develop all the complications of renal failure.
Right.
That patient you are supporting for the time until his disease recovers. And then again he will be dialysis free for a while.
Okay.
But important problem is all those who develop acute kidney failure, even if they recover, about 1.5 to 1.7% of the patients develop chronic kidney failure.
Okay.
Secondly, in ICCU where our patients are critically ill, if they develop kidney failure requiring support, prognosis is different.
Right.
They don't do so well as those who don't need us or don't develop kidney failure.
Right.
So that way it is very vital.
Okay. So can you tell us what is kidney transplant? Can you show should every dialysis patient should undergo kidney transplant? Are there any precautions to be taken or any risk factors, or in certain situations where we cannot undergo transplant? What is kidney transplant, sir?
Kidney transplant is an option, the best option for those who have permanent kidney damage or on regular dialysis, who require regular dialysis. As I said, we do dialysis only 3 times a week, 12 hours.
Right.
Plus it's only a supportive treatment, it doesn't do many functions that a normal kidney does. So anyway, kidney transplant will be a better option.
Right.
From where do we get the kidney? So one is from the relatives,
Right.
blood relatives from the family, that is father, mother, brother, sisters. And then if none of them are suitable medically, then one can think about extended family,
Okay.
uncle, aunts.
Right.
For that special, the law is there. You have to satisfy all the compliances there, and then one can opt for transplant.
Okay.
Second, the most common thing is we require a compatibility. That blood group is the first option. If you get a compatible blood group, is the best.
Right.
But in case you do not have a compatible blood group, that is AB, A is versus B, or A versus, like that. Like AB is universal recipient, O is universal donor.
Right.
Now if I am A, I am a patient, and my donor is B, earlier we would reject.
Right.
But now with the modern therapies and better understanding, this also can be done, requires a special procedures to be done.
Okay.
And causes a little extra financial burden, but this can be done.
Okay.
And it is more important because of the paucity of the organs. We don't get kidney. It's not so rapidly available
Right.
that one would think. Because commercial thing is banned, and rightly so.
Right.
So if some of the relatives are not willing or not medically fit, or they also have certain congenital conditions run in a family where you cannot get a donor, in that case one has to opt for cadaver donor. Cadaver donor means the one who is brain dead, and if the relatives are willing, if the given patient is willing, he makes a consent which he gives to his relatives earlier.
Right.
That I have a card in my pocket which says, please accept my kidneys, your scheme when I die.
Right.
So that consent form is now everywhere available.
Okay.
And if you keep that, and if the relatives are willing, they understand that one cadaver can save the lives of so many people.
True.
You get a liver, you get 2 kidneys, you get skin, you get heart,
Right.
you get lung, you get intestines.
Right.
Everything can be transplanted,
Right.
including bone graftings, corneas, everything. Everything you say is
True.
and you know what is the value of each organ.
Right.
You can't put a value. We do not appreciate because we have normal functional organs.
True, sir.
Moment day one you see is a little less because of cataract, you know what is the value of that lens.
True.
So same way is for this. So you have an option, cadaver transplant, and the cadaver transplant so far is not extremely well developed in this country.
Right.
But it is still rapidly progressing, and because it requires support from the state.
Right.
You have to have a lot of administrative and state support, legal support. But both of them do well.
Right.
Both of them do well. 1 year survival is almost now touching 97%.
Okay.
5 year survival almost 35% live related donor.
Right.
It's a little less in maybe incompatible donors. If the kidneys function well and they do well, though they have to take drugs lifelong, they'll be like anybody.
Right.
And they can be world ski champion as well.
Okay.
So that much is the level we achieve.
Right.
Even in dialysis, patients have achieved that. Some of the ski champion of the world was on dialysis. But these are very few.
True. But then nothing is impossible.
Yeah, but you get a normal life. Your quality of life is so good with the dialysis, with
Right.
the transplant compared to dialysis.
Right. So I guess on World Health Day, we, the team of doctors, would encourage people to
Donate.
fill up the forms for organ donations.
Yes.
Who can save, one person can save a lives of at least 8 to 10 people. That would be a
Yes.
request from our side. Of course, we cannot force everybody, but then it is a healthy practice to do. Yeah, we have with us Dr. Mitali Bhadra madam. She had an emergency patient of an heart attack, so got little late. But madam, on World Health Day, thanks for saving a life. And talking about heart attack, can you tell us what are the common symptoms of heart attack? How should I know that I am having a heart attack? Because many of the time we feel it is only gas problem, and we ignore taking acidity medication, and we drink soda and cold drinks, we do rest, it might be dehydration, and number of excuses we have. So madam, can you tell us what are the symptoms, or how do I know that I have a heart attack?
So most of the patients, they experience a pain which is a sort of discomfort or a chest pain on the left side of the chest, which usually radiates to the inner aspect of the left arm, to the neck, to the jaw and to the back. It is usually tightening, squeezing, or a discomfort. Patient feels uneasy during that time. It is associated with sweating, breathing difficulty, breathlessness. This is a majority of the cases present in this way. A few patients may present with a burning sensation in the upper abdomen, which is associated with nausea, vomiting sensation, giddiness, and it is usually mistaken for acidity, gas. Either patient ignores it or takes acidity antacids and ignores it.
Right.
So few of the patients, they have very atypical presentation. They may have right-sided chest pain or just no pain, only breathing difficulty. Diabetic patients, they usually don't experience chest pain. It is just the breathing difficulty which that may point out towards a heart issue.
Right.
So any form of chest pain should not be ignored. It should undergo a cardiac evaluation. So because it's an emergency.
Right.
So identifying the chest pain symptoms is the most important part, which the first step which the patient has to do it for himself.
Right, because initially we used to see heart attacks only in the certain age group,
Yes.
above more of 60s, then started decreasing to 50s. Now these days we are seeing lots of young guys at the age of 30s and 40s having heart attack. More of it is due to stress, more of lack of exercise, sedentary lifestyle, bad eating, all addiction, smoke, drink and everything. We are seeing too much of blood pressure increase in the young age groups these days. So what are the symptoms basically of high blood pressure, and what level should it has to be treated, and is it bad, or what are the side effects the high BP can cause? Can you elaborate please?
Most of the patients, they have no symptoms. Even if the blood pressure is very high to a dangerous level, so it is usually picked up when a patient comes to the doctor for some other reason and it is diagnosed. So it is very crucial that all of them after the age of 40 years should get their blood pressure checked at least once a year.
Right.
And those who are at a high risk, diabetic, or who have a strong family history or a sedentary lifestyle, obesity,
Right.
they should get it more frequently.
Right.
Some of the patients, they may have got headaches, giddiness, or nasal bleed may be a presenting feature of high blood pressure, or they may present with chest pain. Chest pain can be an indication you have blood pressure.
Okay.
Or they may present with arrhythmias as palpitation or a thumping sensation in the chest.
Okay.
So the best way is after 40 you should get it checked once a year. It should be
Right.
ideally checked.
Right. Madam, I personally feel that it is not only above 40s. I think we should do regular BP checkups even in schools, colleges, in the offices, in our buildings and societies. You never know where a silent killer lies. So early detection is always better. So we would encourage people to just have once screened, especially if you have a strong family history, if you have a stressful job, then not to ignore. But then at the same time, does these people have heart problems and BP and sugar, can they go for vigorous exercise, especially gym? Because many of the times we are listening that person was in gym, was a marathon runner, he had a sudden cardiac arrest. So should diabetic or a hypertensive patient or a cardiac patient exercise, and should he go to the gym, or what kind of exercise he should do?
We were always listening that exercise and gymming is very good for heart, it prevents heart disease.
Right.
But all of a sudden we are now hearing that a lot of heart issues like MIs in the gym after post marathon,
Right.
post vigorous exercise.
Right.
So that has led to us to think like why these things are happening.
Right.
Okay, one thing is like either your heart has no capacity to exercise, or that heart is not prepared for exercise.
Right.
First thing I would like to elaborate, if the heart is not doesn't have the capacity, if the pumping of the heart is low prior to any exercise, normally the EF is around 60%, but the EF is low either due to heart blockages or due to cardiomyopathy. So if the EF is low and such patients they try to exercise or join gym, it is going to precipitate a cardiac arrest or an MI.
Okay.
So first and before joining any gym or marathon or doing vigorous exercise, I will suggest you should get a cardiac evaluation, a basic cardiac evaluation to rule out if the heart is actually fit to undergo that strenuous exercise.
Right.
So it can be either low EF or it can be arrhythmia issues which can be evaluated by a simple test like ECG. We can pick up arrhythmias, or we can pick up valvular aortic stenosis. So that can prevent these people from exercising and succumb to MI or cardiac arrest. Second thing is lack of preparedness of the heart.
Right.
So suddenly one day we decide I have to exercise, and we do a lot of exercise without a proper cool down, without proper warm up.
Right.
So that the heart is not prepared for such a vigorous exercise.
Right.
So we have to gradually train our heart to for the exercise.
Right.
So that is like when you join a gym, there should be a proper warm-up session like stretching and all, and proper cool-down session. The weight lifting should be gradually increased, not in one day I
Right.
feel I should lift all the weights.
Right.
So it should be gradually increased, and the between two exercises there should be a gap period, so that you should allow your body to rest and then do the second exercise. Third thing is hydration level is very important during exercise. So between exercise you can take sips of water. So hydration is important, and gradually train our body so that the exercise capacity increases. Exercise is good, but in a long term.
Right.
It has the good effects in the long term, not too much, not overdoing of exercise on one day or within months. That is not good for heart.
Right.
So I will suggest all of the patients who want to join gym or marathon or any form of vigorous exercise, they should get evaluated by basic tests like ECG, 2D echo, so that we can pre-handedly diagnose it, and we can if it is there, we can train the heart so that they can undergo exercise.
Right. So you say, madam, ki once I had a heart attack or I had my angioplasty or a bypass surgery, I can start exercises, and how soon should I start?
Post angioplasty, we normally make the patient, second day we make the patient walk.
Okay.
So, and third day we ask patient to continue all his normal activities. There is no
Right.
restriction at all, no movement restrictions at all.
Right.
So though it has to be a gradual process. Initially we start from 5 minutes, 10 minutes, and we gradually increase. I have seen all the patients come back again are those who have stopped their medicines.
Okay.
Nowadays the drugs are wonderful, the stents are wonderful, and but the only problem is like the patient feel now I am okay, so there is no need of medication.
Right.
So once the only patients who stop their medicines, they come back again, they land up again with
Okay.
both restenosis because the stent gets blocked again.
Right.
So once the stent is a foreign body, it gets endothelized after 3 months.
Right.
But a medication is needed so that the clot doesn't develop again.
Right.
So we gradually taper the antiplatelets like over the 3 months after 1 year.
Right.
But at least one blood thinner is required so that there is no complication with the stents. So a patient should not ideally stop medications on their own. Okay, only under the guidance or under certain like if the patient is undergoing a surgery or anything, only under certain conditions and under guidance only we can stop the medication and we need to restart it again.
Right. So I think a regular checkup and let your doctor decide what
Yes.
medication to be stopped and when is the best thing to have a normal healthy life. But many of the times we are seeing patients who had an angioplasty, who are taking regular medication and everything, still they get a second episode of an MI or a heart attack basically, or a stent blockage. So what is the reason for that?
First, the most common cause is patient has stopped the medication. Second is most of these patients are diabetic, those who have got cardiac issues. So if the sugars are not under control, they are going to get new atherosclerosis.
Right.
Third thing is like the cholesterol level. It is the most preventable cause for the cat. So
Right.
if we keep the cholesterol level under check, so it should be done every 6 monthly in patient who had an MI, or otherwise it should be done once a year.
Right.
So that if the cholesterol, LDL cholesterol is, which is the bad cholesterol, we keep it under check, then these things can be prevented. Other thing is smoking. Smoking is the most common cause of cat and cause of reoccurrence also, because they tend to stop it for few months and then restart it again.
Right.
So other thing is lifestyle. As a bad lifestyle can cause it also, and you need a good lifestyle so that there is no new atherosclerosis.
Right.
So a good lifestyle is needed, and a blood pressure control.
Right.
So all these things can prevent a new atherosclerosis.
Okay. So do you suggest a normal healthy person, like I don't have diabetes, I don't have blood pressure, I don't have any other complaints like chest pain, feeling breathlessness, I do moderate exercises daily. Do you suggest I should undergo, I mean I'm reaching 40, should I undergo a cardiac evaluation? Should a normal healthy person should undergo cardiac evaluation, or it has to be only patients and in patients if diabetic, hypertensive, at what interval they should?
Actually, heart is once lost, it is very, the pumping once lost is not regainable.
Okay.
So, prevention, it is good for all organs, but for heart also, prevention is the main aim, to preserve the pumping of the heart.
Right.
So, if you can catch up heart disease prior hand, so you can preserve the heart,
Right.
the pumping of the heart.
True.
So ideally after 40 years we should get evaluated. Cholesterol is most preventable thing. If we keep our cholesterol under control, we can prevent MIs, we can prevent CAD. So we should be evaluating after 40 years. Once a year cholesterol should be checked. But those who are at a higher risk, like those who have a strong family history, or they have got those who are smokers, a sedentary lifestyle, they have a lot of stress, they can get it early also. So there is a very good risk score, atherosclerotic CAT score.
Okay.
So you can ASCVD risk score. So we can get it done. We can calculate our score, what category we are fitting it, and accordingly
Right.
we can get evaluated. Like how frequently we need to get ourselves evaluated.
Right.
Those who already have some valvular problems, they have to get it. They are 3 echoes every yearly, and those otherwise they can get it every 5 yearly.
Right. Sure. It was really a nice and a healthy discussion, and today on World Health Day, it is lovely. I mean, you all took out time from your busy schedule to just tell my patients, our patients, my audience, what care we should take and how to live. But at the end, I guess the moral of the story is it's better to have a healthy diet, to have a good sleep, a stress-free life, less of addictions or no addictions, regular exercises, taking care of your breathing exercises, your walking, your daily exercises, regular water intake, as sir said, at least 2 to 3 liters a day, having less of junk food, oily food. And the most important is that after some age you should go for regular health checkups, so that you can catch up many of the diseases, including heart disease, kidney disease, your lung diseases, neurological problems, plus certain diseases like cancers and all. So regular screening, regular checking can prevent lots and lots of diseases. So wish you all a very healthy World Health Day, to take care of our own health and to take care of our patients too. Thank you all for coming.
Thank you.